Welcome to the deep dive. Today, we're looking at a condition in animals that, well, it might catch your eye, quite literally, ectropion.
That's right.
It's when the eyelid rolls outward, and while it might look like just a cosmetic thing, it can actually lead to some pretty significant eye health issues down the line.
Exactly. We've looked into the research, and yeah, atrochen is essentially the air version, that's the technical term, or rolling out of the eyelid margin.
Okay.
And this exposes that delicate inner lining, the palpebral conjunctiva.
Mm-hmm.
What's really interesting is how this seemingly small change can mess with the eye's natural protection.
So an eyelid turned outwards, why is that such a big deal for the eye itself?
Well, the eyelids are crucial, right? They spray the tear film across the eye, keep it moist, wash away little bits of debris.
Hmm.
When that lower lid rolls out, the whole system gets disrupted.
Okay.
Tears don't spread evenly. Sometimes they can't even drain properly through the tear ducts, the nasolacrimal ducts.
Ah, the ones that go to the nose.
Yeah, those tiny channels. So instead of draining away, tears can spill over. And the eye itself can get dry, irritated, just really vulnerable.
And that constant exposure, that dryness, that sounds like it opens the door for more serious stuff, doesn't it?
Precisely. The eye's natural barrier is compromised, so it's much easier for bacterial infections to take hold, sometimes recurring ones.
Mm.
And what's more, the cornea, that clear front part of the eye, can get damaged from not having enough lubrication and protection. We call that exposure keratopathy.
Okay.
And if that's not dealt with, it can absolutely threaten the animal's vision.
Wow. Okay. So who are we typically seeing this in? Is it common across different species?
It's interesting, actually. Ectropion is overwhelmingly a dog issue.
Really?
Yeah. While cats can get it, it's extremely rare. So our focus today really is on dogs. And even within dogs, certain breeds are way more likely to develop it.
Ah, the breed predispositions. Which ones are we talking about here? Any particular types where you see it pop up more often?
Absolutely.
Mm-hmm.
There's a definitely higher rate in sporting breeds. Think spaniels, hounds, retrievers, those types.
Okay.
Then you have the giant breeds, St. Bernards, Mastiffs.
Mm.
They also show a tendency.
Right.
And maybe less surprisingly, breeds with that really loose, wrinkly facial skin. The classic example is the bloodhound, of course. Their skin structure just affects eyelid support.
So those unique looks we love in certain breeds can sometimes bring these health considerations. Does it tend to show up suddenly or develop over time?
It can actually happen at different stages. There's what we call developmental ectropion.
Okay.
That's often got a genetic link in those breeds we just mentioned, and it can show up in puppies, even dogs under a year old.
Young. Okay.
Then there's acquired ectropion. This tends to develop later in life, maybe in breeds that aren't typically prone to it. Often it's linked to aging, loss of facial muscle tone, skin getting a bit looser.
That makes sense. Genetics early on and then just life happening later on. Is that all, or are there other types?
Well, there's one more fascinating type, intermittent ectropion.
It's intermittent.
Yeah. This one's often triggered by fatigue. So an owner might only notice it after their dog's had a really hard run or when they're super drowsy.
Hmm.
It's almost like the muscles holding the eyelid just temporarily relax too much.
That's quite subtle. So moving beyond the intermittent type, what are the more consistent signs an owner might see that point towards ectropion?
The most obvious thing, usually, is seeing that lower eyelid visibly rolled outwards. It actually loses contact with the eyeball itself,
You can just see it hanging down.
pretty much. And you'll often see the pink, moist inner lining the conjunctiva. Sometimes the third eyelid might look more prominent too because the lower lid isn't holding it in place properly.
Okay, so visually, it can be pretty clear in a lot of cases. Any other clues owners might pick up on?
Facial staining is a really common one.
Ah, the tear stains.
Exactly. Because the eyelid isn't sitting right, tears can't drain properly through those ducts we talked about, so they just spill over onto the face. That often leaves those reddish-brown marks below the eyes.
Right, that makes total sense now.
Yeah. And owners might also report a history of discharge.
Hmm.
It could be thick and mucus-like or even pus-like if there's an infection.
Because the conjunctiva is exposed.
Right. It gets irritated and it's more vulnerable to secondary infections. And another thing, because that rolled out lid can form a little pocket.
Ah, like a little shelf?
Kind of, yeah.
Yeah.
Owners might notice recurring irritation because little bits of stuff, grass seeds, dust get trapped between the lid and the eye.
Ouch.
Yeah. And just a history of repeated bacterial conjunctivitis, eye infections. That should also make you suspicious.
Okay, so definitely not just cosmetic. It can really kick off a chain reaction of issues. We've covered who gets it and the signs. Let's dig into the why a bit more. What are the main underlying causes and risk factors?
Well, like we touched on, those breed-related differences in facial structure and how the eyelids are supported are a huge factor.
Right.
Think about all that loose skin on a bloodhound. The sheer weight and the folds around the face can naturally just pull the eyelids downwards or outwards.
It's almost built in a way. What about those cases that develop later, the acquired ones? What's going on there?
Significant weight loss can play a role, or losing muscle mass around the head and the eye sockets.
Oh, so?
The supporting tissues basically shrink or diminish, letting the eyelid lose its tight fit against the eye. And interestingly, dogs with hypothyroidism,
The thyroid condition.
yeah, where the thyroid gland isn't active enough, they can sometimes get this droopy, almost tragic-looking facial expression. And that could be associated with ectropion, too.
That's a really interesting connection, a hormone issue affecting eyelids.
It really shows how interconnected things are in the body.
Yeah.
And we also have to consider scarring,
Scarring from what?
maybe from an old injury to the eyelid. Or, sometimes ironically after surgery, to correct entropion, that's the opposite problem, where the lid rolls inward. If the correction isn't perfect or there's scarring,
So fixing one problem could potentially lead to another.
in some cases, yeah. That scar tissue, we call it cicatricial disease, can pull and distort the eyelid margin.
So it sounds like a mix of genetics, breed traits, aging, weight changes, other diseases, even past interventions. Now, if an owner thinks, my dog might have this, what happens when they go to the vet? How is it diagnosed?
Often, it's pretty straightforward, honestly. The vet can usually see the eyelid version clearly during the physical exam.
Just by looking.
In many cases, yes. But especially if it's not a typical breed for ectropion or if it pops up later in life, it's really important to look for any potential underlying medical cause.
Right, because it might not just be the eyelid itself. What sort of underlying things would a vet consider?
Well, they might think about conditions that reduce the tissue mass around the eye socket. Something like masticatory myositis.
Masticatory myositis. What's that?
It's an inflammatory disease that affects the chewing muscles.
Okay.
Also problems with the palpebral nerve, that's the nerve controlling the eyelid muscles. If that nerve isn't working right, you lose muscle tone, which can look like or worsen ectropion.
Nerve issues too. So what about standard lab tests? Does blood work or urine analysis usually help diagnose the ectropion itself?
Not directly for the ectropion, no. Standard tests like a CBC biochemistry profile or urinalysis aren't usually diagnostic for the eyelid position itself.
But they might be useful for other reasons.
Exactly. They might be run if the vet suspects an underlying systemic issue that could be contributing to it, like the hypothyroidism we mentioned.
Gotcha. But are there more specific tests that might come into play sometimes?
Yes, definitely. If masticatory myositis is on the radar, there's a specific blood test for autoantibodies against certain muscle fibers, the type 2M ones.
Okay.
And like we said, if there are signs suggesting nerve problems or that tragic face, testing thyroid hormone levels is a really logical step.
What about imaging, like x-rays or scans? Are those typically needed?
Generally, no. Imaging isn't usually required for diagnosing ectropion. The vet's physical exam is typically enough to identify the condition itself.
Okay, so mostly based on the exam, possibly some specific blood tests for underlying causes. Are there specific things the vet might do to the eye during the exam to assess the impact?
Absolutely. A full neurological evaluation is key if nerve paralysis is suspected. Remember, that can link back to things like hypothyroidism.
Right.
And because secondary conjunctivitis inflammation of that inner lining is so common with ectropion.
The infections you mentioned.
Yes. The vet might take a sample for bacterial culture or cytology. That helps identify the specific bacteria, if any, and choose the best antibiotic.
Makes sense, target the treatment. What about checking the eye surface itself for damage?
That's where fluorescein or rose bengal stains come in. These are special dyes.
Oh, the ones that glow under blue light.
Fluorescein does, yes.
Yeah.
They highlight any damage on the cornea, like scratches or ulcers, that might have happened because of the exposure. They really help show the severity of the situation.
So building a complete picture, exam, maybe blood tests, specific eye checks, which brings us to the crucial part, treatment. How do you manage ectropion?
For the milder cases, where there isn't constant severe irritation, supportive care might be enough.
What does that involve?
Usually, regular use of topical lubricants, eye drops, or ointments to keep the surface moist and protected. Sometimes ointments with antibiotics are used preventatively or if there's minor inflammation.
Yeah.
And just good hygiene, keeping the face clean, wiping away discharge.
So sometimes just keeping it lubricated and clean is the main approach.
It can be, especially for that intermittent fatigue-induced type. Surgery isn't usually recommended for those cases.
But for more severe chronic cases.
Yes, if there's significant ongoing irritation and exposure, then surgical correction is often the best long-term fix.
And what does surgery aim to do?
The main goal is to shorten and tighten that lower eyelid so it sits properly against the eyeball again. There are different techniques for eyelid shortening.
Okay.
In really pronounced cases, especially with lots of loose facial skin contributing, a more extensive procedure might be needed. Sometimes it's even referred to as a radical facelift to provide enough support.
A facelift for a dog, that really drives home how much loose skin can be involved. What about medications? Besides the lubricants, what else is used?
Well, if there's a bacterial infection, conjunctivitis, or a corneal ulcer, then topical broad-spectrum antibiotics are crucial.
Like eye drops.
Yes, or ointments. Things like neomycin polymyxin, bebacitracin combinations are common, but the choice might be guided by those culture results we talked about, applied several times a day usually.
Okay.
And we continue with the lubricant drops and ointments alongside antibiotics to combat the dryness. And really importantly, if an underlying cause like hypothyroidism or masticatory myositis was found.
You treat that too?
Absolutely.
Yeah.
Treating the underlying condition is vital. Sometimes improving that condition can actually improve the ectropion itself.
So it's often a combined approach, symptoms, underlying causes, maybe surgery. Are there any treatments that are definite no-nos or things that interact badly?
Generally speaking, for the ectropion correction itself, there aren't major specific contraindications or drug interactions to worry about universally. It's more about choosing the right surgical technique for the individual dog's situation.
Right.
And with meds, it's the standard stuff, making sure you use the right antibiotic for the bug, managing any other health conditions properly. Nothing uniquely problematic just because it's ectropion.
Okay, that's reassuring. Lastly, for owners whose pets have been diagnosed, what's the outlook? What does follow-up look like?
It's important for owners to know that sometimes, especially if it's related to aging and progressive skin laxity, the condition might worsen gradually over time,
Even after treatment?
potentially, or if it's being managed non-surgically. That's why regular monitoring is so key for those patients not having surgery.
What should owners be watching for?
Signs of recurring eye infections, worsening dryness causing that exposure, keratopathy, any signs of corneal ulcers developing, or even skin irritation around the face from constant tear overflow that's called facial dermatitis.
So it really requires ongoing vigilance, especially if surgery wasn't done.
Exactly. Regular vet checkups are really important to track how things are going and adjust the management plan if needed, just to keep the pet comfortable and protect their eye health.
Well, this has been a really thorough look at ectropion. So to recap the key takeaways, it's that outward roll of the eyelid, often seen in specific dog breeds due to genetics, and while it might seem minor, it can cause significant eye problems if not managed correctly.
That sums it up nicely. You should now have a pretty solid handle on what ectropion is, what causes it, the signs to look for, and how veterinarians approach treating it.
And thinking about all this, it does make you wonder, given these clear genetic links in certain breeds, what role does responsible breeding really play in trying to minimize conditions like ectropion? And maybe stepping back, what other seemingly small physical traits in our pets might actually hint at deeper health implications that maybe we, as owners, should be more aware of? Definitely some food for thought there. Thanks for joining me for this deep dive.